Hello everyone, good morning. My name is Aisyah Fadia. I'm a veterinarian working at the Sumatran Orangutan Conservation Program. And my slide wasn't on. So in this occasion, I will tell you a case that one of the cases that happened at our center. Is it about a critical care management of a wild orangutan with a severe head trauma? Okay. Okay, my name is Aisyah, but people usually call me Aisyah. So I've been working at the Sumatran Orangutan Conservation Program for over 4 years now. I was located in North Sumatra, Medan, but we also have sites across Aceh. So we sometimes do rotation with other veterinarians. So this case that I will tell you in this occasion is actually very interesting because it's a very long case, but I will try to make it into a 15 minutes before but when this chicken starts to squeaking. Okay, so it started on May 15, 2024. At our center in North Sumatra, we received an orangutan, a female estimated to be around 25 years old, whom was rescued from a landslide event in Gayolues, Aceh. So we named her Ramo after the village that she was recovered from. And we immediately know that it was such an emergency situation. So we do the basic triage, ABCD. The first one is we check the airway. So Ramo has aspirated a significant amount of mud. It's filling her oral cavity. So at first we make sure that the mud doesn't obstruct any of the airway. And then the next step, we check for her breathing. She's actually having a quite difficult in breathing with a respiration rate around 16 to 36, but she still have a quite good oxygen saturation. And the next, thankfully, she did not have any external bleeding, but she do have an increase in heart rate for over 130 beats per minute. And then because of this is a trauma patient, we check for the disability. So it's very obvious that she arrived with a comatose state without any response to external stimuli. And then she also suffered multiple traumatic injuries with an extensive lacerations on her hands and also her face. And she has a very uneven cranial contour and swelling on both eyes. And this is for a side note that she's actually actively lactating, which means that she's a mother, but she arrived at our center without the presence of her baby. And we immediately gave emergency treatment after she's arrived. And this treatment is, our main aim is to stabilize her conditions. We're giving her fluid, pain medications, and anti-inflammations, antibiotics, and other supportive care. And then on the next day, we actually saw that she is bleeding on the picture there from her nostril and also from her ear, which we gave vitamin K. And the vital signs were quite alarming because the respiration rate are increasing and heart rate is decreasing, and the temperature is also declining. So based on the clinical signs and the history of the orangutan, we suspect her to have a severe head trauma. So the next day, when we feel confident enough to do a further diagnostic, we we do a full body X-ray. In this situation, usually we need to do CT scan, but we do not have access to any CT scan, so we do what we can. And we found that she has a fracture on her left zygomatic on her head, and she has also a multiple fracture mostly on the right side of her body. And then on the same day, because we suspected there are an increase in intracranial pressure, we added nootropic of piracetam for neuroprotectant, and also we started her on hyperosmolar therapy with hypertonic saline. And the couple of next day 4 and day 6, this is a video. This is actually Ramo in her delirious state, but she has shown some gradual increase in consciousness with grip reflex, and when she started to pinch back the hands that we pinch. And then finally on day 5, she is starting to blink her eyes, which is a very small step, but it gives us hope. And she also have a very cloudy black eyes. And for the next couple of days, day 7 to 11, this is when, this is also a video of Ramo regaining her motoric function. And she is also able to make a small movement with help. And, but actually around this time, it's when the infection starts to kick in, the VBC white blood cell level is also spiking, and there are post-accumulations on her multiple wounds. So this time we start to give antibiotics more aggressively. And then on day 12, when the infection has started to go down, we finally feel it's confident enough to put her under the major procedure. So on the day 12, we do the first orthopedic surgery, and the aim is to correct her clavicula and ulna fracture. And then the post-operation care at day 13 to day 17. This is a video of Ramo regaining her movement. And actually on day 14, 2 days after our major operation, she started to sit up by herself, which is a very major milestone for Ramo at that time. You can see that she's actually more responding. Okay. And this is just a treatment summary of the first 17 days that Ramo came to our center. I will just skip that, okay. And a month later, it is on June. This is also the transition process for Ramo, because at this time, we start to change the medication. We stop all the injections, and then we go all with oral medication. And also in this time, she has started to feed more regularly. We fed her 3 times a day. This is a video of Ramo feeding time. At that time, she's already started to show sign of aggression by biting, which is very good because Ramo is a wild orangutan. So it is a good progress, and we also started to do a physiotherapy. And this is the blood result over time from the first month. What I want to highlight is on day 7, is this the white blood cell level and neutrophil are spiking, and after we did the treatment, it's also gradually decreasing. And the 3 aspects, the red blood cell, hemoglobin, and hematocrit, which actually declining or decreasing over time. And this also is a video of Ramo. This is Ramo 2 months later, 2 months after she came to our center. She is become more and more active, and she is also responding well to stimulations. This is our caretakers bathing her with food. And then you can see that she's already starting to sit by herself. She's moving along just fine. And even at this state, she's very food motivation. And we can feed her 3 times a day with a gradual increase in food textures. And we also do the daily cleaning on her multiple wounds. And actually 3 months later, we found that Ramo had an abscess on her mandible. It's quite big, and when we radiograph it, it actually has bone fragment on her mandibula. So we fixed that and we drained the abscess and we do a culture. We also give her another dose of antibiotics. And in here, the C-reactor protein or CRP was actually still quite high 3 months after. And this is also a video of Ramo progress 3 months later. In here, she has started to climb, she has started to vocalizing, and she is becoming more self-aware and become more aggressive. And this is the picture of Ramo in June, and then this is the picture of Ramo in August. You can see that a very significant difference in how the way she looks and just in her eyes. So in month 4 and 5, we're focusing more on correcting her carpal dislocation, but we did not success at that time. And on month 6, she still have impaired vision on her left eye. And this is the blood result of her time. The 3 factor red blood cell, hemoglobin, and hematocrit was actually slowly but steadily increasing, which is good. And then for the first time in day 177, the inflammatory marker were finally in the normal range, 0.5. And then this is the wound progress. In Ramo, we started to incorporate traditional medicine for the wound progress. And in here, in June 8, and then in 19 June, in the span of just 10 days, you can see there are a significant difference after we started using the traditional medicine. And yeah, unfortunately, on the November 27, it's approximately 6 months after Ramo admission to our center was struck with a major landslide, and Ramo was also one of the orangutan that are heavily affected by this landslide. So it was Ramo's second landslide disaster. But this is the condition that we found Ramo. Actually, we found her on top of the trees, and she's moving very active, but she's not actually moving from tree to tree. And we also rescued her immediately, and we do a quick physical examination, and thankfully she did not suffer any major injuries, unlike the first one. And then in this one, after a very, very difficult process, we actually managed to bring her to a safe space where we can continue her rehabilitation process and also treatment. And then fast forward to 2025, this is Ramo's condition. You can see that the carpal joint dislocation has led to a bended wrist joint, and it's inhibiting her from moving freely. So after our consultation with experts, with orthopedics, we then decided to do mid-humerus amputation to get rid of the bad arms. And then this is Ramo 1.5 years after the procedure. She can move more freely without the weighted arms, and then she has a significant improvement in her body conditional score. And this is Ramo in 2025. So in this period, we are focusing more on her mental rehabilitation, because not only physical that we are focusing. At that time, Ramo is very scared, shy, and timid. She is scared of loud noises. And then her caretakers encourage her to spend more time outside by hanging and scattering food around the island, so she can spend more time outside. And this is Ramo current situation in 2026. There is a video in here. This is how she is moving now. She moves more freely, and she has a beautiful long hair. Okay. And actually, our current assessment is she is recommended to be a permanent resident at Orangutan Heaven. So this is just a mind map of our thought process during the Ramo case. The first thing that on the very first days, the thing that our top priority is to stabilize her vital. After we control that, we continue to control her infections and also whilst giving her pain management. After the infection has gone down, we correct the major fractures. And then the next step was to do a physiotherapy and manage her wound progress and also manage her nutrition. And then after a very long considerations, we decided to do the amputations on her carpal joint. And this is just a take-home message that I can give during our time with Ramo. First one is to prioritize life-saving treatment, especially in emergency patients before we even have the chance to do diagnosis and therapeutic procedure. And then it is very hard, but we need to maximize our available resources that we have at our center. And then we have to foster effective networking, because in Ramo case, actually we work very closely to Lily Parkinson, the emergency veterinary specialist. So we all can agree that without Lily advice, maybe Ramo wouldn't make it this far. And then we are also blessed with a very resilient and strong team that actually very dedicated in the taking care of our patients, and we need to prioritize animal welfare as long as having practice patients, which can be very difficult.
Thank you.
So this is the acknowledgement of many people who have a major role of their own in this case. So shout out to everybody. So this is just a little transition pictures of Ramo. So Ramo survived to landslide and still got her sparks back.
Thank you, Aisyah.
Thank you so much.
Thank you. Thank you for very good explanation. So I'll be called for the next presenters is Daria. If you have a question for Aisyah, Aisyah will become for the panel discussion together with Satya on before lunch. So just keep it the question there. Make sure the question hard for her. Are you ready, Daria?
1 second.
No rush, no rush. Just go. No rush, just go. Okay, thank you. Please get the applause for Daria.
Okay. Hello. My name is Daria Chuprak. I'm a head vet at LCTW, and I'm very happy to be here, as I discovered that Jakarta and Yogyakarta are different cities. Thank you, organizers, who helped me to reach this place. Yeah, and today I would like to share our experience with drugs used to reduce anxiety and stress in wild animals during emergencies. I will mainly talk about diazepam, gabapentin, and trazodone, because these drugs pretty easy to get in Laos. And first I will explain how drugs work and publish studies, and then I will share our own experience. During an emergencies, animals are stressed not only by environmental threat, but also because of capture, transport, small cages, unfamiliar surroundings, and changes in their normal routine. This can cause fear, can cause stress and anxiety, so stress management is really important, as this stress can lead to injuries, aggression, refusal to eat, and deterioration in condition. And our goal is not only it's not deeply sedate the animal, but to reduce fear and keep the animal calm, responsive, and safe. So we will start with diazepam. Diazepam, it's a benzodiazepine. When all neurons has GABA receptors, and when they are activated, chloride ions go inside the neurons, and making it less excitable. Diazepam has this effect, and this can reduce fear, anxiety, muscle tension, and agitation. And the main advantage is its rapid action, which makes it useful during severe acute stress. the disadvantage that it can accumulate, and repeated dosing may lead to excessive sedation. There are several useful studies in primates. You can scan QR code and find these articles. For example, in rhesus macaques, one study showed that a single dose of diazepam before social introduction improved pairing successfully. And another study showed more mixed results. In marmoset, lower dose reduced anxiety and fear responses, while higher doses caused more sedation. And diazepam also was used with the bear, which were pretty successful with transportation of the bear. Also, when we are working with primates and with apes, and sometimes we can compare how these drugs can affect people, and it really could be helpful because humans can tell us what they are feeling, how is it working, and also, in human medicine, it works quickly and can strongly reduce anxiety and panic, but diazepam stays in the body for a long time, and it's also can accumulate. So, diazepam is most useful for rapid short-term control of severe stress. Okay. Next, gabapentin. A nerve cell has calcium channels. Once these channels open, calcium enters the nerve cell. Calcium helps the cell release excitatory neurotransmitters, and gabapentin binds to part of these calcium channels. This reduces calcium entry into the nerve cell. So fewer excitatory neurotransmitters are released, and the nerve cells become less overactive. As a result, pain, arousal, and stress reaction can decrease. It can be especially useful when pain or hypersensitivity may be part of the problem. It can also cause sleepiness or poor coordination, but usually the effect depends also of the dose, and with like small dose it doesn't affect too much. Also, we need to make sure that the animal doesn't have any low blood pressure, and the animal not lethargic, as it can make it worse. Gabapentin, also there are some evidence from different species. Primates showed a good result of using gabapentin, the peak effect in 2 hours. With bears, usually, like we have one evidence where people used it to pain relief with combination with meloxicam, and more evidence with cats and dogs, where we can see how gabapentin working, like reducing shelter stress, provide acute calming, and it's pretty popular in cats and dogs medicine. Also in humans and people, gabapentin is mainly used for neuropathic pain and epilepsy. It's also sometimes used for anxiety and sleep problems. Sleepiness can appear after the first dose, but some effects become clear after repeated treatment. And compared with diazepam, gabapentin is more suitable to repeat for a long time because there are lower risk for accumulation. But after long-term treatment, it's also very important to remember to reduce it gradually, not stop it suddenly. Trazodone. So nerve cells communicate using serotonin. After serotonin is released, some of it's normally taken back into the nerve cells, and trazodone partly blocks this reuptake, and serotonin stays longer in synapse between the nerve cells. Trazodone also blocks some serotonin receptors, especially 5-HT2 receptors. This changes serotonin signaling in the brain. As a result, arousal and anxiety can decrease. At lower dose, trazodone can also cause relaxation and sleepiness. We don't need to wait several weeks to see a calming effect. Some calming can happen after the first dose, and this makes trazodone useful when stress continues for several days. And for wild animals, we can see that not so many evidence. We can see more evidence with cats and dogs because people usually use it for transport animal to reduce stress during some stressful procedures, and it can also decrease cortisol. So it's very popular in cats and dogs medicine. In humans, studies show that the effect of trazodone depends on the dose. At lower dose around, it mainly causes relaxation, sleepiness, and lower arousal. High dose are used as an antidepressant, but they also should use it pretty long time, several weeks, to reach antidepressant effect. So now I will tell how we used these drugs during our emergency situation. A fire came close to LCTW and there was heavy persistent smoke throughout the center. We did not know if the fire would reach us, and we would need to evacuate all the animals. We moved gibbons and langurs into transport cage so we could move quickly if necessary, far away from the fire. And the bears we kept inside a secure door enclosure to protect both the bears and people if the outdoor fences were damaged. When the primates first moved into small transport cages, some of them showed severe acute stress. At the stage we needed a fast effect, so we chose diazepam. We used 0.5 milligram per kilogram. After the first dose, the change was clear. The animals were calmer and rested in more relaxed position. Inside the cage, animals that still showed a high level of stress continued to receive diazepam. After the animal became calmer, our goal changed. We no longer needed such strong and rapid control, but the animals still had to stay in the small cage for several days. So some gibbons were changed to gabapentin and trazodone. We used gabapentin at dose 10-15 milligram per kilogram, and trazodone 5 milligram per kilogram. So you can see that here, we don't have so many gibbons, but all of them just we kept in one room, and they were pretty close to each other. And we also saw the positive effect of some gibbons. They started to interact with each other, but before, that gibbon really scared to interact with another one. So we really saw positive effect. And from our experience, diazepam was more useful when the stress was severe and acute. Gabapentin and trazodone were more useful for continued support after the animals were already calmer. Sometimes one of these drugs alone was not enough, so we used combination of gabapentin and trazodone. Also, sometimes gabapentin powder pretty bitter, has bitter taste, and in this way, if animal doesn't want to eat, we choose trazodone, or in last reason diazepam, if we don't have any other options. With bears, for the bears, our decision was based partly on our previous experience at LCTW. During an early relocation at the center, we used combination diazepam, gabapentin, and trazodone with pretty low dose, but because it's combination, we can choose lower dose. And animals were pretty calm. We used these drugs during 3 days when the rate of fire was high. And they showed pretty good effect. They didn't find that, they were just calm. And we also need to remember that we can administer these drugs rectal. If, for example, we anesthetize this animal and we need calm effect, we can also do it rectal, especially diazepam and trazodone. We have some evidence that it's working, but with gabapentin, less evidence that it's working, but with my experience with bears, it's also working well, but we need to be prepared that animals will waken up pretty long time after this administration, after recovering anesthesia also. The primates stayed in transport cages for about 5 days. The bears received calming medication for 3 days. Helicopter helped contain the fire, and heavy rain stopped the flames from spreading. And when the smoke and danger decreased, the animal returned to the normal enclosure and we stopped the emergency medication. So the drugs helped us manage the animal safely until the emergency was over. Helicopter doesn't work. All right. And here is the video, but we're very happy.
Good morning, everyone.
Just posted
good
it.
news,
It's without,
good news.
Sound,
Last night it
posted
rained.
on Facebook. How we're happy
So we
that
are
everything.
very excited. Good morning, everyone. Good news, good news, good news. Last night it rained.
Yeah, it was very
so
good
we
news
are
for
very
us.
excited.
Yeah, so-
hopefully that put out
Yeah.
the fires around us, near us.
It's really our management, stress management really helped us to keep all animals safe, reduce stress, and the right drug depends on the species, the severity of stress. We need, if we need a quickly effect, we use diazepam. If we need longer effect, we can use trazodone and gabapentin, as these drugs sometimes doesn't work very fast, but still works pretty fast. So these are references which I used when I prepared my presentation. Thank you for your attention. I tried to do as fast as possible. If you have any questions, yeah, just feel free to ask. Yeah.
Thank you, Daria. It's fantastic for the two speakers. All of them is rapper.